What if the very act of sleeping tonight could quietly set the stage for a stroke by sunrise? This isn't merely a dramatic query. It is a reality supported by emerging scientific investigation. Recent research reveals that close to one-third of all strokes take place either during the night or in the initial hours after awakening. These events are frequently not linked to emotional strain, high cholesterol, or forgotten medication. In numerous instances, they are quietly tied to a factor most individuals never consider: their sleep habits. Just a few weeks ago, I treated a 68-year-old patient, active, nutrition conscious, with healthy cholesterol levels, who unexpectedly experienced a stroke shortly after getting out of bed. There were no preceding warnings. As it turned out, the cause was not related to his diet or family history. It was his sleeping posture, aggravated by several other nighttime routines. Before we explore that further, welcome back to the program. I'm Dr. Ethan, and as usual, I'm joined by my good friend and co-host, Dr. William Lee, as we investigate the hidden science behind the health choices we make every day. Thank you, Ethan. You see, most individuals perceive strokes as sudden, random occurrences. But the truth is, your risk escalates as your circulatory system becomes more vulnerable. This process often begins around age 50. As we grow older, blood tends to thicken overnight. Blood pressure can surge with positional shifts during sleep, and seemingly minor anatomical habits, like how you align your neck or the orientation of your heart, can carry significant repercussions. We cannot command the precise moment we drift into sleep, but we can control the manner in which we sleep, and that distinction is everything. In today's discussion, we will unveil 5 hazardous sleep practices that elevate your stroke risk while you rest. We will also disclose the 2 safest sleeping positions for your brain and heart, and share straightforward tips to transform your bedroom into a stroke-resistant sanctuary. If you value safeguarding your brain, your heart, and your future, please take a moment to like, share, and subscribe. This could be the most crucial episode you encounter this year. The unsettling reality is that many strokes do not occur during times of stress, but rather during sleep. That's correct. At a time when your body is meant to be restoring itself, certain concealed habits may actually be placing silent strain on your brain and heart. Most people are unaware that the small decisions we make before and during sleep can interrupt blood flow, increase intracranial pressure, and even activate arterial plaque. Let's examine 5 dangerous sleep habits I encounter frequently, particularly in patients over 60. The first one may astonish you: sleeping flat on your back without any pillow support. This is more common than you might imagine. Many individuals believe that reclining flat on your back, perfectly horizontal without a pillow, is somehow beneficial for spinal health. But for older adults, especially those with hypertension or mild sleep apnea, it can be a formula for catastrophe. Here's the mechanism. When your head is level with or lower than your heart, gravity pulls blood toward your upper body. This may not be consequential when you're young, but as you age, the blood vessels in your brain become more delicate. This posture can elevate intracranial pressure, diminish oxygen flow, and stress the microvessels in your eyes and brain. Some of my patients wake in the middle of the night with throbbing headaches, dizziness, or blurred vision. Many never associate these symptoms with their sleeping position. The most alarming part is that these signs are often early indicators of more profound circulatory problems, including strokes or microbleeds in the brain. So how do we address this? The solution lies in elevation, but not excessive elevation. We recommend using a medium-height memory foam pillow to gently raise the head so it is approximately 15 to 30 degrees above the heart. This is sufficient to aid venous return without straining the neck. If you struggle with acid reflux or snoring, you might also benefit from an adjustable bed that slightly elevates the upper body. This relieves pressure on the diaphragm, enhances breathing, and reduces nocturnal spikes in blood pressure. And that is just the first habit. Stay with us. We have 4 more silent sleep risks to discuss. Let's proceed to the second dangerous habit: sleeping on your right side, particularly for individuals with heart concerns. Most people don't give a second thought to which side they sleep on, but the reality is the position of your heart within the chest cavity genuinely matters. When you lie on your right side, your body weight shifts and compresses one of the body's major veins, the inferior vena cava, which is responsible for returning blood to the heart. This vein runs along the right side of your spine, and pressure on it can slow blood return, forcing your heart to work harder to draw blood back in. Precisely. And let's remember that the human heart leans slightly to the left. So when you lie on your right side, the heart is pressed toward the chest wall. This can restrict its movement just enough to reduce pumping efficiency, especially in older adults whose hearts are already under duress. For most healthy people, this may not create major issues, but for someone with high blood pressure, congestive heart failure, or even occasional nighttime chest discomfort, this sleeping position can exacerbate symptoms. In fact, some cardiologists now believe that chronic right-side sleeping in people with cardiac conditions may increase nighttime arrhythmias or cause subtle drops in blood oxygenation. So, what should you do if you fall into this category? Here's a practical adjustment. Try sleeping on your left side instead. This position not only alleviates pressure on the inferior vena cava, but also allows the heart to pump more freely by granting it space to move. And if you find yourself rolling back during sleep, there's a simple trick. Use a body pillow. Hugging a firm pillow in front of you helps maintain spinal alignment and prevents accidental turning. We'll explore why the left side position is ideal in part 3. But for now, if you have any history of heart issues, avoiding right side sleeping could be one of the simplest yet most powerful changes you can implement. Next, here's something I often observe in patients seeking nighttime comfort: stacking 2 or 3 pillows beneath their head. Many do this thinking it assists with breathing or acid reflux, especially as they age. But the truth is, using too many pillows or an excessively high pillow can quietly create more harm than good. When your head is pushed too far forward or upward, your neck bends unnaturally, compressing the blood vessels that run along the spine and into the brain, particularly the vertebral arteries. These arteries are critical for delivering blood to the brainstem and inner ear. If they are even partially restricted during sleep, you might not notice immediately, but over time, it can lead to poor circulation, tension headaches, neck stiffness, and even dizziness upon changing positions in the morning. Yes, and I've had patients who wake with stiff necks, tight shoulders, or that unpleasant half-head headache, attributing it to stress or aging. But after adjusting their pillow height, these symptoms often vanish within a week. That's how powerful proper alignment is during sleep. What's insidious is how chronic over-elevation of the head affects microcirculation in the brain. Over time, it may even contribute to tiny vessel damage, rendering the brain more susceptible to silent strokes or transient ischemic attacks, the so-called mini-strokes. So how do we correct this? The approach is gentle. Use one well-designed pillow, preferably a low to medium height memory foam pillow that gently supports the natural curve of your neck without pushing your chin toward your chest. And if you genuinely need to sleep on an incline, for instance, due to acid reflux or breathing issues, use an adjustable bed base or a wedge pillow that lifts your entire upper body evenly, not just your head. This way, your neck remains neutral and blood flows smoothly through the arteries nourishing your brain. Sometimes the smallest adjustments, like changing your pillow, can make a profound difference for your long-term brain and heart health. Let's move together to one of the most common sleep positions I see, especially in older adults, the fetal position. This is when a person curls up tightly on their side with knees drawn toward the chest and the chin tucked in. It's instinctive, comforting, and emotionally soothing. But from a circulatory and respiratory standpoint, this posture can quietly create conditions for real problems overnight. When you curl up tightly like this, the spine bends forward, the chest compresses, and the lungs have less room to expand fully. Over time, this leads to shallow breathing throughout the night. And when oxygen intake is reduced, so is oxygen saturation in the blood, a risk that grows with age, especially for those with underlying cardiovascular or pulmonary conditions. Right, we often overlook how sleep posture affects oxygen delivery to the brain and heart. In this curled position, there is also increased tension in the neck, shoulders, and upper back. That kind of prolonged muscle tension can compress small blood vessels around the cervical spine and base of the skull, leading to poor circulation in that region. Some patients report waking with dull headaches or neck pain, never suspecting their favorite sleep position is to blame. That's why we recommend a few gentle modifications, not to eliminate the position entirely, but to make it safer. Try gently straightening your legs a bit instead of tucking them tightly. Maintain a more neutral spinal alignment and avoid excessive curling of the upper body. Using a body pillow or a full-length cushion between your knees and arms can help sustain a more natural, relaxed posture without triggering that coiled-up reaction during sleep. It's not about sleeping stiffly, it's about sleeping smart. Small changes like these can open up your breathing, reduce pressure on the heart and brain, and improve your overall sleep quality. Last, but certainly not least, is a habit that often flies under the radar yet carries serious consequences: going to bed immediately after eating dinner or consuming alcohol. It may seem harmless at first glance, but for people over 60, this combination can silently prepare the ground for a stroke. Let's break it down. When you eat a large meal, especially in the evening, blood is redirected toward the digestive system to aid in breaking down and absorbing nutrients. But this also means less blood is available for the brain during those critical nighttime hours. In healthy adults, the body adapts, but in older adults, particularly those with narrowed arteries or cardiovascular risks, this redistribution of blood flow can increase the likelihood of lightheadedness, dizziness, or even fainting during sleep. And if we add alcohol to the picture, the risk escalates further. Alcohol acts as a vasodilator, meaning it suddenly expands blood vessels, which can lead to a drop in blood pressure. For seniors, especially those with pre-existing plaque or unstable blood flow, this sudden drop followed by compensatory spikes can trigger unpredictable blood pressure swings. These fluctuations are dangerous because they stress vascular walls, potentially causing a rupture in weakened vessels or forming clots in areas where blood flow becomes erratic. You might recognize the warning signs: waking up feeling foggy, with a pounding head or a racing heart. Those aren't merely signs of poor sleep. They may be symptoms of a circulatory event during the night. Here's our advice. Finish dinner at least 3 hours before bedtime. Give your body time to digest. And if you choose to drink alcohol, stop at least 5 hours before sleep to allow your system to stabilize. After dinner, take a light walk. Around 15 to 20 minutes is sufficient. This gentle movement promotes circulation, reduces glucose spikes, and regulates digestion, all of which support safer, deeper rest and lower your stroke risk. Now, let's explore something that could transform your life starting tonight: the 2 best sleeping positions for heart and brain health. We've discussed dangerous habits. Now it's time to shift gears and show you how to sleep smarter, not just longer. First up, left side sleeping. This may surprise some because we often think of sleep as passive, but how you position your body actually alters blood flow, organ function, and even how your brain clears waste. Sleeping on your left side is especially advantageous for several reasons. First, anatomically, your heart sits slightly left of center in the chest. When you sleep on your left side, you reduce the pressure your heart must work against, particularly at night when circulation naturally slows slightly. The result is better blood flow to the rest of your body, including your brain. It's also about gravity. In this position, the inferior vena cava, that large vein carrying deoxygenated blood back to the heart, is in a more favorable position. There's less compression, which helps the heart work more efficiently with less strain. And it doesn't stop at circulation. One of the most fascinating discoveries in sleep science over the last decade involves the glymphatic system, your brain's waste clearance network. Think of it as the night janitor that sweeps away toxins and waste proteins while you sleep, including amyloid beta, the compound linked to Alzheimer's. Studies show this brain cleaning process works best when you sleep on your left side. Why? It relates to fluid dynamics and how lymphatic and glymphatic fluids drain. Side sleeping, especially in the left, promotes more efficient cerebrospinal fluid flow, reducing the risk of buildup that can damage neurons over time. There's also good news for anyone dealing with acid reflux. Left side sleeping helps keep the junction between the stomach and esophagus above stomach acid, which reduces nighttime reflux symptoms. This is a game changer for folks with GERD or those who wake up coughing or with a sore throat. If you've ever experienced that burning sensation in your chest after a late meal, sleeping on your left side could help you rest more comfortably and protect your cardiovascular system in the process. So that's position number 1, left side sleeping. But what if left side sleep isn't comfortable for you? Or perhaps you suffer from joint issues or shoulder pain that makes it difficult to lie that way. That brings us to the second best position, which works for a wide variety of health conditions, especially for blood pressure regulation and circulation. The second position, sleeping on your back with slight elevation. This isn't lying flat like a board, and it's not propping yourself up as if watching TV. This is a gentle incline, raising your upper body about 15 to 30 degrees. You can achieve this with a wedge pillow, an adjustable bed, or even a stacked pillow setup that doesn't force your neck into an awkward position. Why does this work? First, it promotes balanced pressure across the body. When you sleep on your back with slight elevation, blood flows more easily back to the heart, especially from the lower body. That's a major benefit for people with poor circulation, swollen legs, or chronic venous insufficiency. There's also a neurological benefit. With slight head elevation, intracranial pressure can be reduced, lowering the chance of small vessel rupture or microstrokes in people with fragile blood vessels or hypertension. That's especially important for seniors, where even tiny hemorrhages in the brain can lead to long-term cognitive decline. Plus, breathing improves in this position. For people with congestion, sinus issues, or mild sleep apnea, elevating the head can open the airway, reduce snoring, and lower the risk of oxygen desaturation overnight. That means better oxygen delivery to the brain, and again, that means stroke protection. Now, a small but important tip. Elevate your knees slightly as well. Place a small pillow under your knees to help relieve pressure on your lower spine. Maintain natural spinal curvature and reduce lower back pain. This combination, elevated head and slightly raised knees, creates a zero-gravity-like posture that reduces pressure across key joints and vessels. But here's the truth. Not every position works for every person. If you have sleep apnea, for instance, back sleeping, even with elevation, may still trigger airway collapse. In that case, side sleeping is better. If you have heart failure, the left side is ideal. If you have shoulder arthritis, back sleeping might offer more relief. The key takeaway is not to pick the best position in theory, but the best one for your body. And don't forget the bigger picture. No matter your position, sleep duration and quality matter too. Aim for 7 to 8 hours of uninterrupted sleep. That's the time your body uses to regenerate blood vessels, balance hormones, repair tissues, and keep your nervous system in check. So here's our recommendation. Start tonight. Adjust your pillow. Try sleeping on your left side or elevating your upper body. Monitor how you feel. Small changes in how you sleep can lead to significant changes in how you age. And remember, how you sleep is just as important as how long you sleep. Your heart, brain, and entire vascular system will thank you for it. All right, we've walked through the science and sleep positions. Let's turn our attention to something just as important, your bedroom environment. Because here's the truth. You can sleep in the right position, but if your sleep is poor quality, fragmented, or filled with hidden stress signals, your brain and heart are still at risk. So, here's how to make your bedroom stroke-proof. First, keep your bedroom cool, ideally between 18 to 20 degrees Celsius. A cooler environment helps your core temperature drop, which is essential for deep, restorative sleep. It also helps lower nighttime blood pressure, reducing strain on delicate vessels in your brain. Next, eliminate blue light after 9 p.m. That means phones, tablets, TVs, and harsh overhead lighting. Blue light suppresses melatonin and delays the onset of deep sleep stages, especially the ones where your brain clears plaque, your heart rate stabilizes, and inflammation subsides. Then, use proper neck support. A pillow that supports the natural curve of your neck can make a massive difference in blood flow to the brain. Avoid overly flat or excessively high pillows. We talked about this earlier. A memory foam pillow with a cervical contour is a great investment. Lastly, eliminate disruptive noises. Sudden sounds can jolt you out of deep sleep, raising heart rate, spiking cortisol, and creating what we call micro stress events that you might not remember, but your vascular system certainly does. Use earplugs or white noise machines if needed. And if you're someone who wants to take things a step further, let's discuss nighttime health tracking, because your body gives you signals even while you sleep. You just need the tools to catch them. First, try an overnight pulse oximeter, SpO2 monitor. This small device clips onto your finger and tracks oxygen levels. If your oxygen drops repeatedly during the night, it may signal sleep apnea or poor circulation, both of which raise stroke risk. Next, track your HRV, heart rate variability, with a smartwatch or sleep ring. Low HRV overnight may reflect autonomic nervous system stress, often due to inflammation, high blood pressure, or metabolic issues. It's an early marker of poor recovery. And finally, keep a simple sleep journal. Write down how you feel each morning. Do you feel groggy? Have headaches, numbness in the hands, or light dizziness? These can be subtle signs of microstrokes, poor oxygenation, or circulatory stress while sleeping. Let's step back for a moment. Most people only think of sleep posture in terms of back pain or comfort. But as we've seen today, sleeping incorrectly can silently increase your risk of stroke, especially after 60. It affects blood flow, oxygen delivery, vascular pressure, and even toxin clearance in the brain. The beauty of it all is you don't need a prescription. You just need awareness. Change one habit, just one, and your stroke risk could drop dramatically. Exactly. Don't underestimate the power of small nighttime changes. Better sleep position, better environment, better data. You're not just preventing stroke, you're investing in brain longevity, cognitive clarity, and a healthier cardiovascular system for years to come. So now we want to hear from you. Which position do you usually sleep in? Do you often wake up tired or with brain fog? Share your experience in the comments. And don't forget to like, share, and subscribe if you found this episode helpful. We'll see you next time with more on preventing stroke, memory decline, and restoring vitality after 50.